Hi, I'm Joanne from the Full Spectrum Centre Limited, an award-winning wellness and vocational training centre, and you're listening to the Full Spectrum Wellness Podcast. This show is all about physical, mental, emotional and spiritual wellness, and it's for people who are looking to improve their overall health and well-being. Each week, I'll share with you all the positive takeaways, tools, techniques and tips that I've gathered in both my personal and professional wellness journey that will help you to look, feel and be well. With a dose of motivation and meditation to keep you going, I'll be joined by a few friends who will be sharing their insights along the way too. Welcome to episode 30 of our Full Spectrum Wellness Podcast. I'm so happy and excited to be back here with you for our 30th episode. Now today I'll be diving into an important topic that affects women's health across the United Kingdom and the globe, and that's health screening, specifically focusing on breast and cervical screening. Now, at the time of recording in June, it's Cervical Screening Awareness Week, and I recently attended my own screening for cervical cancer, amongst other tests and scans for ovarian cancer and a biopsy on the 2-week pathway for endometrial cancer at St Mary's Hospital in Manchester. It's been a scary and stressful few months, I'm not going to lie, since I reported my symptoms to my GP back in November 2022. Now, thankfully, I don't have cancer, but I am high risk because of my polycystic ovarian syndrome and along with the fact that I've never had a baby or a pregnancy. But I recently started a preventative treatment in the form of HRT, so hopefully endometrial cancer will not develop. And if it hadn't been for those screenings, tests and scans, I wouldn't have had my biopsy and I would have been none the wiser and would probably have just put my symptoms down to my existing condition or even the menopause. Now, one of my dear friends has also been through her screening journey with breast screening recently, and unfortunately for her, the story is very different. But in just a few short weeks, she's had life-saving surgery and is about to embark on a regimen of chemotherapy and radiotherapy. And she'll be joining me as a guest on a future episode to share her inspiring story and her journey to wellness. So that's why I wanted to talk about this health screening as a topic on the podcast. So you can already see why regular health screening is crucial. Screenings are preventative measures that help detect potential health issues before they become more serious. They give us the opportunity to catch any problems early, which often leads to more successful treatment outcomes. Now let's begin with breast screening. Breast cancer is one of the most common cancers amongst women in the UK, and early detection is key to increasing survival rates. The NHS offers breast screening to women aged 50 to 71, inviting them every 3 years for a mammogram. Mammography is a low-dose X-ray that can detect small changes or abnormalities in breast tissue, often before they can even be felt. By detecting potential breast cancer early, the chances of successful treatment and improved outcome significantly increase. However, it's important to note that women of all ages should be breast aware and should report any changes or concerns to their healthcare provider promptly. Self-examination and being familiar with the look and the feel of your breasts are also valuable practices for all women. Breast awareness involves getting to know how your breasts normally look and feel so that you can identify any changes or abnormalities. Self-examination is a valuable practice that every woman can incorporate into her routine. So if you notice any changes such as lumps, thickening, nipple discharge, or changes in the shape or appearance of your breasts, it's vital to seek medical attention promptly. Now moving on to cervical screening, commonly known as the smear test. Cervical cancer is largely preventable and regular screenings play a vital role in its prevention. The NHS invites women between the ages of 25 and 64 for cervical screening every 3 to 5 years, depending on their age. During the test, a small sample of cells is taken from the cervix to check for any abnormalities that may lead to cervical cancer. These screenings have proven to be highly effective in reducing the incidence of cervical cancer and saving lives. But did you know that cervical cancer is one of the most common forms of cancer in women under 35, with 2 women in the UK per day dying from the disease. Regular cervical screening appointments can prevent up to 75% of instances of cervical cancer, saving 5,000 lives per year. But did you also know that almost 1 in 3 women and people with a cervix don't take up that invite? Now, many women feel anxious or uncomfortable about these tests, and absolutely anxiety and discomfort are understandable emotions. But it's important to remember that healthcare providers and professionals are there to support and guide you through the process. Your comfort and well-being are their top priority, so don't hesitate to voice any concerns you may have. We know that cervical screening isn't easy for everyone. When I attended my cervical screening for my smear and I had my biopsy, it wasn't a pleasant experience. But I used deep breathing techniques during those procedures to help calm my nerves and deal with the discomfort. It's also worth noting that health screenings are free of charge through the NHS in the UK as part of the national screening programmes, so there's no financial barrier preventing you from taking care of your health. Make sure you're registered with a GP and keep an eye out for your screening invitations. If you miss an appointment or you're unsure about your eligibility, contact your GP or healthcare provider to ensure that you receive the necessary care. Now, there are also private healthcare options available for those who prefer additional screenings or wish to access them at different intervals. Private screenings may offer a wider range of tests, including genetic screenings for hereditary conditions or more in-depth assessments of specific health markers. It's important to consider your individual needs, your preferences, and your budget when making decisions about private screenings. Now, in addition to breast and cervical screenings, there are other screenings available that cater to different aspects of women's health. These may include screenings for osteoporosis, sexually transmitted infections, and cardiovascular health. It's important to stay informed about these screenings and consult with your healthcare provider to determine which ones are relevant to you based on your age, medical history, family history, and lifestyle choices, as well as risk factors. Now, osteoporosis is a condition characterised by the loss of bone density, making your bones weak and prone to fractures. It predominantly affects postmenopausal women, but it can occur in men and younger women too. Now, the National Osteoporosis Society recommends that a bone density scan, also known as a dual energy X-ray absorptiometry DXA scan, for women over the age of 50 or younger women with specific risk factors. This scan measures bone mineral density and it helps to identify individuals at risk of osteoporosis and fractures. Early detection allows for timely intervention such as lifestyle changes, dietary adjustments and medications to prevent any further bone loss and to maintain bone health. Sexually transmitted infections, or STIs as they're commonly known, are another important area to consider. Regular STI screenings are crucial for sexually active women regardless of their age, and the NHS provides free and confidential STI testing, including tests for chlamydia, gonorrhea, syphilis and HIV. These screenings not only help in the early detection and treatment of STIs, but they also prevent the transmission to partners and potential long-term health complications. It's essential to normalise conversations about sexual health and to promote regular STI screenings as part of a comprehensive approach to women's wellness. Cardiovascular health screenings are equally important for women. Cardiovascular diseases, including heart disease and stroke, are leading causes of death amongst women in the UK. So regular blood pressure checks, cholesterol level assessments and blood sugar screenings are key components of cardiovascular health screening. And these screenings help identify risk factors and allow healthcare providers to develop personalised prevention and management strategies. Additionally, lifestyle modifications such as a healthy diet, regular exercise, stopping smoking and stress management are also crucial for maintaining heart health. Bowel cancer is the 4th most common cancer in the UK and it affects both men and women. The NHS offers bowel cancer screening to individuals aged 60 to 74 and they provide a home testing kit called a fecal occult blood test, or FOBT. And this test helps to detect small traces of blood in the stool, which can often be an early sign of bowel cancer or other bowel conditions. Early detection allows for timely intervention and improved treatment outcomes. So it's crucial to complete the test and send it back as soon as you receive it to ensure the best possible results. For women planning to start a family or already pregnant, prenatal and antenatal screenings are vital. These screenings help assess the health of both the mother and the developing baby. Prenatal screenings such as ultrasound scans and blood tests can help identify any potential genetic or structural abnormalities in the fetus. Antenatal screenings, including blood pressure monitoring, urine tests and fetal heart rate monitoring, are performed throughout pregnancy to ensure the well-being of both mother and baby. And these screenings enable healthcare providers to provide appropriate care, support and interventions when necessary. Another significant aspect of women's health screening involves mental health and emotional well-being. Mental health conditions such as depression and anxiety affect a substantial number of women. Regular mental health checkups with healthcare providers and professionals can help identify early signs of distress and ensure appropriate support and treatment are provided. These screenings are particularly important during significant life transitions such as pregnancy, postpartum and menopause, which is when hormonal changes can impact mental health and mental well-being. Now, there are many women's health organisations and charities in the UK that provide valuable resources and information on various health screenings, so it's essential to stay informed about the latest guidelines and recommendations. Additionally, staying proactive in scheduling and attending screenings, as well as maintaining open communication with healthcare providers, ensures comprehensive care for women's health. In addition to the specific screenings we talked about, it's important to mention the significance of regular health checkups and preventative care. So comprehensive health checkups, which might include blood tests, cholesterol level assessments and overall health evaluations, provide a holistic view of your well-being. These checkups help to identify risk factors, address any concerns, and allow healthcare providers to create personalised prevention plans tailored to your needs. Lastly, it's crucial to emphasise the importance of self-care and health promotion practices in conjunction with health screenings. Engaging in regular exercise, maintaining a balanced and nutritious diet, managing your stress levels, getting sufficient sleep and avoiding harmful habits such as smoking or excessive alcohol consumption are all vital components of maintaining optimal health. These lifestyle choices work synergistically with screenings to promote overall health and well-being and reduce the risk of developing various health conditions. Remember, health screenings are not something to be feared or avoided. They are empowering tools that allow you to take control of your health and your well-being. By participating in regular screenings, you're investing in a healthier future for yourself, and they might just save your life. That's all for today's episode of the Full Spectrum Wellness Podcast. I hope you found this discussion on health screenings both enlightening and encouraging. So if you are overdue for your screening, get that appointment booked. If you get an invite through the door from the NHS, reply to it, attend your appointment. As I said, it might just save your life. As always, take care of yourself and stay tuned for our next episode where we'll explore another aspect of holistic wellness. Until then, be safe, be well. Thanks for listening to this week's episode. I hope you found the discussion and the tips covered really helpful. Don't forget to subscribe, and if you enjoyed this episode, please do leave a rating and a review and share it with your friends and family. Pop along to our website at thefullspectrumcentrelimited.com and join our self-care and wellness newsletter club. You'll receive our free 55-page printable self-care guide and workbook. Well, that's all for this episode, but I really look forward to seeing you next week. Take care and bye for now.